And welcome to the Dr. Tommy Show live. How are you guys doing? Today is Thursday, beautiful day here in Wesley Chapel, Florida. I'm Dr. Tommy McElroy, America's free market doctor, and your concierge medicine host for the day and your free market host for the day. And I'm pleased to have as a guest today, special guest, is Chris Markford. He's the co-founder of the Florida chapter of the Florida Free Market Medical Association. Correct?
Close enough. There you go.
No, say it again.
Sure. It's the Florida chapter of the Free Market Medical Association, the same group that was founded by Dr. Keith Smith out of Oklahoma.
Uh-huh.
So they're obviously the home base of it all, but they've been able to create these state chapters throughout the country. I might be wrong. I want to say maybe there might be 8 other state chapters throughout the country. We've started one here in Florida. We actually get to have our first meeting on January 7th. So in a little over a month, we'll be meeting here for the first time, and we're hoping to make something big out of it.
That's a cool thing that's happening because we need more and more ancillary. We're talking before the show that, you know, us as free market medical or free market doctors, membership medicine doctors, we need as much help as we can on the other end with ancillary services, and certainly surgery is one of them. And you are the administrator of the Clearwater Orthopedic Surgery Center?
Yep. So administrator of the Orthopedic Surgery Center of Clearwater, which, because you're right, the concierge medicine, the patients coming in paying cash to be seen by their primary care physician, that's been going on for a very, very long time. But it's all the ancillary stuff, especially when it comes to surgery. Most people don't think of, surgery is something that I could pay cash for. When really it is, especially in an ambulatory surgery center setting where we can really control our prices. You know, we are seeing, I guess we kind of get accused for cherry picking our patients. We're seeing healthy patients, but that allows us to control our cost and keep our costs minimal. So there really isn't any reason why we can't have a set price and be able to share that with the public.
Yeah, so, you know, you talked about cherry picking. I've heard the same thing, and I don't know what that means. Because in a free market, that'd be like saying people who buy Bentleys cherry pick.
Right.
Or the Bentley market cherry picks customers.
Right.
I don't know what that means.
No, it's really us being able to determine our own price and
meet the needs of people who need it. Not everyone has, they may not know this, people out there, but not everyone has these lavish benefits that allow them to go and have surgery or gallbladder surgery. Certainly people in our practice, business owners and things like that, they're self-insured. So they don't really have the ability to just plunk down $20,000 or have their insurance pick it up because they're self-insured.
Yeah. I like to think of it as the illusion of insurance. A lot of patients have. They'll come in with a $10,000, $12,000 deductible. That's not having insurance. That's making you feel like you have insurance.
It's having a card. It's having coverage.
Yeah. So those patients will actually, they prefer just to pay us cash, especially if they're young and healthy and not expecting to ever meet their deductible at the end of the year.
And because they can pay you cash, that a lot of times is like, let's say they pay their deductible. Let's say they have a knee surgery. They may pay their deductible, have their knee surgery at a covered hospital and pay $20,000, or they could come to your center and pay $5,000.
Right. Absolutely.
And either way to them, it's still $5,000.
Because part of it's also taking the fear of the surprise off the table. I personally find it almost of an ethical issue that a patient could go under anesthesia and wake up with an additional thousands of dollars in bills that they never were given the chance to make a decision about.
Exactly. I had surgery once, and then a whole year later, I got another bill. And it was for not a much, $60 or something. But I'm thinking, okay, is it worth, probably 15 hours of my time to figure out, is this $62 actually legitimate?
Yeah.
Or risk them sending me collections, or just pay it? I mean...
And you're not off on that 15 hours because they will make you jump through hoops and transfer you and drop the calls
tell you,
and do whatever.
Don't worry, we got it all figured out. Samantha over in collections has sorted it out. We put a note on your file.
Right.
And then you get a letter a couple weeks later, Allied Capital Management, Collection Associates, and here you are.
They're counting on people just giving up at that point.
And they're right. And they're right.
But
that's why
I would do it to save time.
So tell them about transparency of pricing. So in your surgery center, if someone has a need for surgery, they can pretty much know what the cost of it is.
So I guess our most common procedure that we do at our facility, being an orthopedic facility, is a knee scope, which is a simple procedure where the doctor gets in there, takes a look around at the knee, cleans it up a little bit. It's very simple and easy to do. It takes about 45 minutes. a patient can go onto our website right now and see that to have that procedure all in from the doctor's appointment at the physician office prior to surgery to get cleared for the surgery. It'll include the anesthesia service fees. It includes the facility fees. It includes the surgeon fee. It includes the 90 days of follow-up care following the procedure. All of that would be about $3,850
For all
the
of
knee
that.
scope. For
That's
all of
amazing.
that. If there's any pathology that needs to be done, it's all included.
That's amazing.
It's all included in it. What we have done, and I know some places they vary on their method on this. We have found on our end that we prefer to include the implant cost in our bundled rates.
Yeah, I think that...
A lot of places don't do that, and that's we started out not doing it and became more of a headache for us.
Well, because people get the misconception as, oh, the hip replacement's that much, and they say, well, actually, it's this much because the implant costs so much.
I got tired of saying your surgery is going to cost this much, but it could cost this much more, depending on how many screws we use or how many plates or
People
anything like that.
don't want to hear that.
Nobody ever wants to hear the but. So we've been doing it enough, and we have great relationships with our vendors. We have an average. We know what it's pretty much going to cost from an implant standpoint to do a case. So we can include that number in our reimbursement. Yes, at some of the times it ends up costing us more, and sometimes maybe the patient is paying a little bit more than they needed to. But having that simplicity of cost, we felt outweighed the headache of doing it kind of piecemeal and just paying. Because originally we had it, patient gets a fracture and say their ankle, and the doctor needs to put in some screws and plates. We would add up every screw. The patient would pay for each one, but the doctor doesn't know how many screws he needs until he actually gets in there and starts working. So we would tell the patient, it may cost you $500 in screws. It may cost you $1,000 in screws. We don't know.
Tell us about how you got started with all this, because I know originally you were from Lutz, or you were from Tampa area, and then you went out to California.
I did. I went out to California to get my degree in business and accounting, and to also meet my wife. I guess that was a good reason to go out there. I met her and got married. We came back here with the family. I worked for Price Waterhouse for a little bit. Thankfully done with that. That didn't enjoy that work so much, but now being able to work in healthcare and get back into surgery centers. I actually worked at my first surgery center when I was 16 as just a little office gopher running around. So that's where I got my first taste of the.
You're lucky. I worked
the benefits of it.
My first job was at Taco Bell. I would have loved to work at a surgery center.
Well, I had a great opportunity with that. So I've always loved the ambulatory surgery center space. And an opportunity came up for me at a facility here in Clearwater. And at the time when I had first started, my wife and I were pregnant with our first child. And during the course of that pregnancy, about 3 months in, we were young. We had one of these high deductible plans like a lot of people have. It's really just there in case of an emergency.
Sure.
But we knew we could get pregnant, so we paid extra for the maternity rider to cover the entire cost of labor and delivery and the whole pregnancy.
So in case you did get pregnant.
In case we got pregnant, I had to pay a copay and I was done.
Right.
Well, in the midst of one of the ultrasounds, the ultrasound tech said, looks like your son has a cleft palate or a cleft lip.
Very common.
Very common. And Blue Cross determined, I probably shouldn't say who the insurance company was,
they're
but
not watching.
The insurance company said
We're small potatoes.
That it was no longer going to be covered because they considered it high risk.
Right.
So now because of that, from then on out, I was fighting for every dollar because they were applying it to my deductible. So every specialist, we were at one ultrasound where they brought in a doctor who came in and looked at it for about 2 minutes. I got billed for the tech, for the ultrasound, and for the doctor who came in for a few minutes. Every blood work, everything just became a fight that I had to do.
It becomes exhausting.
Yeah, and I spent hours on the phone just dealing with this, and I felt, as an administrator of a healthcare facility, that while we may just be a simple independent facility, that I can make a little difference in my little world. I've always kind of lived my life by that Gandhi expression. Be the change you wish to see in the world. This was my way of being a change in my little world. So I knew that I had to do something different to make a difference in the customers that I'm serving.
And certainly you are, because where's the farthest that someone's traveled to come to your facility?
We've had North Carolina is probably the farthest we've had people come down. We partner a lot with So there's a few health sharing ministries that are out there that are popular. Samaritan Ministries, Christian Health Sharing Ministries, and so we're listed on their website. So it's a lot of trade workers. I think we've seen some construction guys coming down.
We have people in our practice from the health sharing ministries.
Yeah, so they've traveled, and it was cheaper for them to come down here. One of them brought their whole family. They rented a house and made a vacation at it.
Yeah.
The beautiful thing about being right in Clearwater is I'm minutes away from the beach.
Yeah.
So we have people who come down, have surgery, and recuperate on a hotel, watching the sunset while they recover from surgery. So you really can't beat that. It's a great marketing ploy.
It's like the medical tourism industry.
Yeah,
it's like a lot of the
it's
sales.
It's what we're doing. Yeah, it really is.
Except
we
you don't
can
have to
do
leave the country.
Right. It's medical tourism right here in the country, and there's no reason why we can't do that. We just ran into an issue, and it was unfortunately they got under the radar because it was an issue with the physician's practice, just didn't know. A patient needed ankle surgery. We had the price listed on our website to be done. It was just an ankle fracture. The person at the office didn't know any better, didn't think it could be done, talked to the insurance company, gave the CPT codes. It was too expensive. The patient ended up flying to Guatemala to have surgery that we could have done right down the road for less.
So they flew to Guatemala just because they were given some misinformation.
Because the insurance company told them how much it would cost for them to have surgery based upon the procedure codes and based upon their contracted rates.
Yeah.
So I think it's important for doing what you're doing, getting the word out there, letting people know that there are other alternatives out there. And that's what we're trying to build here in Florida, is creating that independent network of like-minded physicians, of facilities, of healthcare providers that say that we can do this, but let's work together to get that word out.
So talk about the Free Market Medical Association and how you became associated with them.
Sure. Well, when I was first kind of trying to do something new at our facility, I came across an article in the Outpatient Surgery magazine. It was an interview with Dr. Keith Smith, and he was talking about what he was doing out there in Oklahoma City. I took a look at the website, just fell in love with the idea. I reached out to his group at the time, sent him an email. They then got me connected with their Free Market Medical Association that was having their first ever meeting in August of that year. So I flew out for that. It was a small meeting there in Oklahoma City, and we just had the third meeting this past August, and it just seems to double every year.
Oh, really?
It just they can't even fit in the original room because it's grown so much.
Now, the first meeting of the Florida chapter is occurring next year, correct?
Next year, January 7th, 2017.
How do people find out more about the chapter?
Unfortunately, actually, what they could do is if they go to FMMA, the Free Market Medical Association, FMMA.org.
Okay.
There's a link on there for the Florida chapters.
Okay.
They can click right on that. It sends an email right to me, and then I can provide all that information. It's going to be right in St. Pete, right on the beach, one of the hotels. 10 a.m. to 2 p.m., lunch provided.
What is the charge?
No charge.
No charge
for this. We want to get people to see what's going on, hear about it, ask questions. It's just getting the people in the room.
So for all of you out there listening, I mean, that's a no-brainer for me in Tampa. I'll definitely be there. But even if you're not in Tampa, this is a Florida chapter.
I wish I can get you a free room for the night, but unfortunately I can't do that.
No, that's okay.
But you can at least come to the the event.
And you have your co-founder is who?
Dr. Mangar. He's the chief of anesthesia over at Tampa General. He also has ownership in a facility right here in the Tampa Bay area, the Tampa Outpatient Surgical Center. He's got a great passion for this. I met him. He went for the first time to the FMMA meeting in Oklahoma this past August. We hit it off, started talking about what we can do working together and building this. I feel a lot of times I'm limited not being a physician, that I'm just another business guy trying to sell something. But when you get a physician who buys in with the idea and says, listen, I'm living this is making a difference in my practice. This makes a difference in the patients I serve. I think you get other physicians who perk up to that and listen a little bit more because it's a peer telling them, not just some guy, pushing numbers in an office somewhere.
Yeah, but I think you're believable. I mean, you said, you started off in this industry at age 16, so it's not like you're, used to be an executive over somewhere else. And now you just got this title and you're trying to figure it out on the way. You know this inside
and a lot of it is, and that's kind of the beauty of it. Some of it is making it up as you go along, which is okay. Right. We've come across problems, and it's like,
When
Well,
you're a
there isn't an answer
trailblazer, you
for
can
it.
do that.
Yeah,
you can create your own destiny, so to speak.
We have to figure it out. But I think by coming together and working together, we can avoid a lot of those pitfalls because you get that group think. You work together. You talk these things out, and it's amazing what people can do when they come together and try to work this stuff out.
Yeah, we were talking earlier about some of the problems with dealing with people outside of our organizations and how they have this very siloed type of, they're trapped almost by their intellectual incuriosity. And I was telling you before about, Dr. Josh, who's with Atlas MD, and how we got connected with the podcast and the way that the EMR works is just so. It's only for the Atlas MD EMR is only for physicians and patients. The interaction is built around that,
right?
And that's the thing when you have a free market type of environment that you're allowed to become. That's the only reason that I do what I do is to satisfy patients, and free markets are determined by patient pleasure. And it's like there's a lot of this talk in the news today about, not today, but recently, about the minimum wage and how the minimum wage should be $15 or the minimum wage should be higher or be whatever. And Walter Williams says that wages are the prices paid to you based on how well you satisfy your fellow man. And so I am paid based on how well I satisfy my fellow man. The surgery center is paid based on how well they satisfy the customer who is coming there for surgery. And Atlas MD is built around that. And if you want to learn more about Atlas MD, go to AskDrTommy.com and click on special offer for Atlas MD. And if you're a physician out there and you do membership medicine, you get 60-day free trial. But anyway, I think that this movement that we're talking about earlier, we're talking about how I think it's unstoppable. Right. I think there's going to be roadblocks, legislative, but I think the popular will of the people is for price transparency, for immediacy of attention, for personalized attention.
You're going to get this, the innovation is going to come out of it when you're being forced and pigeonholed into these specific way of doing things. Even with like the Atlas MD, you have all these EMR systems out there that have to follow a set rule, but if you can think outside the box and do something a little bit different, you can actually truly meet the needs of the people that we're called to serve. You brought up the $15 an hour minimum wage thing. You have a government that's telling us that we need to do this. And what I just saw the other day was a McDonald's that now has touch screens that are replacing the employees. You have innovation coming out of the government forcing you to do something that doesn't make sense for you as a business.
Well, the important thing, and this is something that's a little nuanced, because here's the thing: is there a good what's the word for it? Is there good intentions behind the minimum wage being $15? I think so. I think if you take the average person and ask them, should people have a living wage? Sure. The question is how do you arrive at that? And how do you arrive at getting a wage that's $15 an hour? Well, the best way to do that is to be able to produce quality or produce a product that exceeds $15 an hour, because otherwise, to be employed, you will never be able to make a profit for a business, and a business will never stay in business. So the best way to make $15 an hour is to be worth more than $15 an hour. That's the first thing. And the second thing is why 15? I couldn't live off $15 an hour. I wouldn't work for $15 an hour. Hell, make it $100 an hour. So you have to be able to understand the way economics are. And a $15 an hour wage is not livable for me. And so certainly it's not a living wage. I don't consider it a living wage, but you have to depend. It has to be able to. What happens is entry level people are being not allowed to be in the market now, because if you are so unfortunate as that your skill set is not enough to justify a $15 an hour wage. Let's say I want to have someone come in here and just scan documents, and to me that's worth $10 an hour. And you pass $15 an hour wage, well then suddenly I am not able to employ that person by law.
Yeah, because we're all bound by our own costs and everything that we have to meet to be able to run the company. So you're absolutely right.
And then, like you said, what happens is, back to what you said about the McDonald's, that people lose their job.
Yeah, and we have the that innovation though that can come out of it. What we've done here now with the Free Market Medical Association and with trying to produce these transparent prices, a lot of that is a result of the insurance companies, the hospital systems. We've been set into this way of thinking that if we can come outside of that and think outside the box, we can actually produce a better product at a lower cost. There's no reason surgeries should be hundreds of thousands of dollars.
Absolutely.
You always see in the newspaper some crazy article that talks about some patient who got upset because of a crazy bill that they received. None of that is necessary. There's a fair price for what you're doing, and being able to set that price in the same way that. Listen, I can go tonight and I could eat at McDonald's. I can go tonight and I could eat at an Applebee's, or I can go to Fleming's. They're all going to be different prices, but I get to make that choice as a consumer. And our people that we serve, our customers, should be able to make that price as well when it comes to their surgery. I could charge if I wanted to. I mentioned earlier the $3,850 for the knee scope. I could charge $10,000 for it, and there will be some people that are okay with paying that price. And there are some people that maybe the $3,850 is still too much. So you have to find where you want to fit in, your little niche as a healthcare facility, and who's the population that you're serving. Set your prices accordingly and adjust as needed. If there was more competition in my area,
prices would be lower.
Maybe my prices would have to go down to stay competitive. Or maybe I say, listen, you're a multi-specialty facility who's doing all sorts of stuff. I'm a single specialty ortho. This is all we do. My staff are experts in it.
And you can
my
charge
doctors,
more.
You should be paying me more for the experience that you have and for our expertise. But allow me as a business person to make that decision.
Yeah, and about the point about if there was more of you, if there were more of us, our prices would probably go down. The reason why is not because we would be because we're like hoarding all this money right now, and now we're just going to have to be more generous. The reason why is because our vendors would also have more competition. So if there was more labs that I could go to, if there were more pharmacies that I could go to, because we give labs and medications away to our, not give them away, we give those to our patients at our price. If those prices dropped, then we'd be able to have more patients come in because it'd be more attractive.
And I think that is another piece of the puzzle that hopefully will be kind of a trickle-down impact on all of this, is the cost of actually... the actual cost of healthcare, the cost of the supplies, the cost of implants. There's there's varying degrees of cost for surgery. The separation in price on implants, that could be the exact same thing made from the exact same place, but depending upon the vendor, the prices are just in complete extremes from each other. So we have a problem with the cost of care as well when it comes to, especially for the high dollar orthopedic stuff that we do. You really have to stay on top of that. But the hope is that if you bring competition into the healthcare setting in actual surgical services, hopefully that will translate and have an impact on what we're paying for actual care, because there is a substantial cost. People get upset when they see that we have spine surgeries that are on there for almost $20,000.
Yeah,
but when you're paying
that's your
for
spine,
you're paying for, but the implant costs themselves could cost $10,000.
Right, and that's your spine. It's not your toe.
Right, it's expensive stuff to do.
If it's messed up,
surgery.
Yeah, I always thought that the people who should get paid the most are people that are like a brain surgeon. Could you imagine how much a brain surgeon should be paid? I mean, they're operating on your brain.
We have spine cases that get done where we have to hook the patients up to neuro monitors just to be able to track what's going on. So when the doctor's in there on the spine, that they're not hitting the wrong spot, or they're getting too close to a certain nerve they shouldn't hit, because it can have a devastating impact. I mean, that's make you sweat surgery.
That's different than taking out a lipoma.
Yeah, that's a big deal. So
or doing what I do, injecting a knee, which I can probably do blindfolded.
So you should be paid accordingly for the high risk, high dollar work.
So tell us a little bit about the surgery center itself, how it got started, and some of the people who are involved besides yourself.
Sure. So the facility opened up in 2001 with a group of about 9 physicians wanting to remain independent, 9 orthopedic doctors. They just built the thing from the inside out, gutted the whole place. It's been a blood bank. I think it's a 50-year-old building, but they just gave it a whole new fresh coat of paint, set it up for the surgery, gave it 4 operating rooms, were 11,000 square feet. I wish I could say that our operating rooms were operating at capacity. They're not, which was part of what this is helping us to do. There was maybe about 5 years ago, some competition came into town, but not the good kind of competition. So this was a facility that opened up that introduced what's known as an out-of-network strategy, where they don't take any in-network insurance. And so they can charge whatever you want. The thing that people don't seem to understand about healthcare is that you can charge whatever you want. It's completely arbitrary. I could charge $200,000 for that knee scope. Doesn't mean the insurance company is going to pay it.
Right.
But I could charge whatever I want. So you set your charges, and if you're out of network, the insurance company's deal is that they'll pay a percentage of those charges. That's the deal that the insurance company works with the person they're insuring.
Right.
But the understanding is that if you go to an out-of-network facility, you, the patient, should be taking on more of the out-of-pocket expense. Everyone can agree with that. The insurance company will pay 50%. Patient needs to pay 50%. But that's your privilege of being able to go to an out-of-network place. Well, what's happening is that if the patient goes to one of these out-of-network facilities and the facility collects from the insurance company but doesn't collect from the patient, they're making a lot of money off of the insurance company, and the patient's getting surgery for free.
Right.
So the patient has no incentive to stop that because they're getting free surgery. And the facility, they may be making $20,000 on a knee scope where the insurance company is only paying me $2,000.
Right.
That's a big difference. That's like printing money. So hopefully, as time has gone on, more and more people are catching on that this is not right, is not ethically right, is not morally right, should not even be considered legally right. So there was a case out in California where Aetna sued a facility doing this, and thankfully Aetna won like $37 million off of this settlement. So hopefully that will create a domino effect. Well, we won't see that because that is bad for the system. It's not what we stand for as a surgery center industry. We're the low-cost, high-care provider. We're not here to take advantage of loopholes and screw the system essentially just to be able to make more money.
And it's owned by physicians.
It does have a corporate owner, which I probably shouldn't say out in the public, so I won't. But they do have it's a big national company that does this all over the country. Okay. This isn't just them; they have facilities all over the country, and this is their business model.
I'm talking about the Clearwater.
Clearwater, we're completely independently owned. We don't do this. It just didn't feel right for me.
So the people who are working on you are the actual ones who are invested in the business.
Right.
So it's not some.
So as an independent facility, our owners,
faceless board of directors over there who are just trying to they need to make sure that the people who come through there are happy with the service,
which gives us great flexibility because now. So that's why what was great about even this is I saw it, I built it. I came up with how we were going to implement it at the facility. I sat down with my board of directors. They gave me the go-ahead, and I was off and running. A lot of times when you deal with surgery centers that are part of a more national group, some of the larger guys, you have a lot of hoops that you have to jump through, a lot of red tape, a lot of getting approval from this department. It just becomes a big thing. We saw a problem, we came up with a solution, and we hit the ground running, and it's worked really well for us. At first, when we first started doing this, it was really, we were targeting the individual patients themselves. How do we reach that patient who might want to pay? The one with the high deductible, the person who doesn't have insurance. But what we found over time, the real market for this is the self-funded employers. I think it's something like with private companies that have more than 500 employees, 85% of them are self-funded.
Yep.
And I think if it's over 100 employees, it's that between 100 and 500, it's 65% are self-funded.
And I think
that's a big number. That's the real customer.
And you guys are a logical partner for membership medicine doctors. You guys being your industry is, outpatient services that are can be expensive because, like you said, for those self-insured companies, if you're a company with say 500 employees, you could partner with a group that has all of the medical services covered by a membership medicine doctor, and then surgery services covered by a surgery center, and then you could really winnow down the cost of your health insurance.
So it's a matter of getting those third-party administrators that manage the plans for the self-funded employers, getting the self-funded groups to find a way to get plugged into those groups. Right now, we're all operating separately. We're all kind of doing our own thing. So that's the hope with the Free Market Medical Association, specifically with the Florida chapter, is that we can come together and be this one-stop shop for all of this care. So that way, when the TPA comes to us, they can see that we're all in one place. There's no having to go and call a dozen different facilities.
And then the goal would be for the future is to get these TPAs not just coming to you because they're trying to give you business. They're coming to you because they need you.
Right.
It's not, I want to get to the point of where we as the service providers aren't just the ones who are out there saying, please pick me. They're coming to us and saying, please allow us to work with you.
Right.
That's the way it should be. I mean,
turn it on its head. It's definitely a disruption of the system, but that's how we're truly going to change healthcare in this country, and it's starting small. Like I said earlier, I just wanted to figure out what I could do with my one little facility and how I can make a difference. And this is just going to snowball, and it's something that I don't think can be stopped, and it's going to actually create good. And it's coming from innovators, it's coming from business leaders, it's coming from physicians directly. It's not some bureaucrat or some government official telling us you have to do this.
Right. I saw something before. It was actually printed by Michael Tatro, who's the editor-in-chief of Concierge Medicine Today, and he had something that was from a Canadian journal. He has a Canadian Concierge Medicine Canada, and they have an MRI machine ban out there in Canada, unless you can have a private MRI, but you have to be able to, for everyone that pays privately, you have to do one scan off of the list, the waiting list.
Gotcha.
And so they're like, okay, we'll do that. Fine.
Yeah.
We'll be glad to do that. And then I guess they were doing so many of them that the local chieftain administrator from their healthcare bureaucracy said, something to the effect that they were criticizing them. And then there was one of the administrators of an outpatient imaging center said, hey, look, they're telling us we need to innovate. And yet when we innovate, they tell us stop innovating.
Right.
But that's what you get with these big central planning organizations, and they know as much about innovation as I know about basket weaving underwater. So they go to these meetings and they say, okay, guys, innovate. It's like the BS bingo. Have you ever seen that, where they have the hashtags like think outside the box, innovate, game plan, circle back, and once you hit all of those, you get bingo. So they hear the word innovate, and that's what they tell people, like, we're going to be innovative as a central planning organization, but they don't know how to innovate. Yeah. They're no more innovative than, if they left them to be innovative, we would still be driving horses and buggies.
And I do think it is tough, and I can understand where they're coming from and wanting to do good things. I know Representative Chris Sprawls out of here in Florida passed a healthcare transparency bill with the greatest of intentions, because I think there's this quote, I might be butchering a little bit, but Governor Scott said that you can never expect healthcare to fix healthcare because there's too much money in it for them.
There's no reason.
They're never gonna fix their own problem.
Right.
So it will take people like yourself, people like me, other like-minded people who say this may at some point, if it impacts the bottom line in a negative way, we got to be okay with that. Right. I might be getting less from certain insurance companies or from work comp or from whoever, but that's the cost of doing something right. And
I think it's doing the thing that even if it is at some level you lose money or you don't do as well, it is the wave of the future. It is. I mean, I can't see how there's going to be people who
it's the right thing to
do things on demand, like watch movies on demand, be able to get taxis on demand, except not taxi, but Uber on demand. There's no way they're going to, that same type of mentality, this immediacy of attention, this immediacy of information. They're not going to just say, okay, but I will go into a surgery and not know the cost of it down to the penny, and I'm okay with that. They're not okay with that. They're not going to ever be.
I don't know about you, but I know, like, when I go to a restaurant, I've already seen the menu, and I basically figured out what I'm going to order before I even step foot through the door, because I've gone on Yelp, I've gone on some online site, I've read the reviews, I know what I want to get. We as consumers in this generation, we're used to going on and figuring it all out ahead of time.
Absolutely.
But we don't do that with healthcare. The thing that could literally save our lives.
Yeah, exactly.
It's
like you're supposed to. It's always surprising to me the people that will be, like you said, like do all that and then go wait in a doctor's office for 3 hours to be seen for 5 minutes.
And thank them for it. And thank the doctor for it.
Yeah. Or be mad about it, but still show up again in 3 months.
Yeah.
Like I say, there is not if I wasn't concierge medicine doctor and I didn't have the ways that I could get medical attention the way I need to from friends and colleagues, I would never sit in an office for that long. If there was a guy that does what I do within 50 miles, I would drive there. Yeah. Just because I cannot afford that. And it would drive me up a wall. So I don't know. I think people don't know any different. Like you said,
they don't.
Like if someone has a knee problem, they may end up paying $20,000 because they don't know about.
So we do have to change in getting that word out there and getting people to realize that there is this opportunity. So when we talk about even from the financial side of the upside for physicians like yourself or facilities like mine, the great potential for this is in getting the word out there. This can be very lucrative. We can make really good money doing this. This isn't about just being a charity. I'm not running a charity. I have a board of directors that invested their good hard-earned money into it. They want to make more money. And this is a way to do that. It takes a little bit of building. It takes about getting the word out there.
Taking risk too.
And it takes getting, especially the employer groups, the self-funded employers. If you had there's one facility out in Orlando, and all they do is carpal tunnels surgery for all Disney employees. So there's an organization that's self-funded. They've direct contracted now with a facility, and they now have the dollars rolling in from that. Now, that's just a simple little small example, but if we did that on a bigger scale, using a lot of these third-party companies that are out there to benefit. I know one right here locally in Oldsmar, Florida, Price MDs, pricemds.com. They have the ability to do that. So now the employers can go in a one-stop shop, find all the physicians from the primary cares to the specialists to the surgery centers to find the right price for them.
And they're making the money the right way because they're making money by being smarter, by saving money and being more efficient, not because they're forcing someone to buy something.
Right.
Disney didn't go to this company because they were forced to by the government. Disney went to them by choice because they found them to be the most effective solution. So if you go to Price MDs, you find the most effective solution versus, that's why that's why any business is a real successful business. Back in the old days, businesses used to become successful by beating their competition, beating the pants off their competition. Now, a lot of the way the business has become successful is they go to Washington, they pay some lobbyists to say, pass a law that punishes my competition and rewards me, and then I'll give you a little bit on the back end.
Yeah, absolutely. And so we have to get out of that mindset. Yeah. We have to change our physicians' mindsets. We have to change the public that we're serving. It's not even, and I shouldn't even use the word changing the mindset. It's opening their eyes to the possibility of what we can do, because there is great potential here. I'm excited to be a part of it. It gives me great joy to do this. I get excited about work and what I do every day because I feel as though I'm doing the right thing in service to my community and service to my doctors who employ me. And it makes you excited for the future of what we can do in healthcare.
So tell us again how to get a hold of both the Free Market Medical Association and your surgery center.
Sure. So our surgery center, if you want to go on and take a look at the prices, it has a lot of frequently asked questions, how the process works. So we're oscc.org, like Omega Sam Charlie .org. And you can go visit that. If you want to learn more about the Free Market Medical Association, that's the FMMA.org, and they have a link right on there for the Florida chapter that sends an email directly to me.
And to find out information about the meeting that's coming up,
email me. But it is on January 7th if you want to mark your calendars. 10 a.m. to 2 p.m. Out in beautiful St. Pete Beach.
Well, thank you so much for coming on and educating us about it. And
happy to do it.
I've been involved with free market medicine now for 4 years, and it wasn't until we were introduced just recently by our mutual friend that we even met each other. But I'm glad we finally did meet each other.
It's all networking. We just got to let each other know we're out there.
That's right. And so for all of you out there listening, I encourage you to go visit those websites. And if you're a physician or interested, or if you're a business, they're eligible to come to the meeting as well.
Absolutely.
We'll have a lot of good fun, sounds like, and look forward to continual fruitful relationship. And thank you again for coming on today.
Thank you for having me.
And so for all of you out there listening, if you want to learn more about Ask Dr. Tommy Show, go to AskDrTommy.com. You can click on Dr. Tommy Live, which is what we're watching now. You can do the Ask Dr. Tommy Show podcast, and there's also a whole plethora of information on there. There's commentary, there's lighthearted stuff, there's serious stuff, there's stuff about music, stuff about boxing, stuff about celebrities, and then stuff about medicine. And also there is a patients tab and a physicians tab to learn more about free market medical solutions. But thank you all for joining us, and until next time, take care and bye-bye.